No, we won't do that. All the important folks are here. 12 o'clock, I will gavel in the meeting of the House Health Subcommittee. Does anybody have any personal orders? Welcome to our sparse audience here, but highly qualified. If none, we have a calendar, and we'll begin with that calendar. The first item on the calendar is House Bill 17. Oh, I'm sorry. Ms. Clerk, if you'd call the roll, please. I know all the folks, so I just kind of passed over that.
Representative Boyd, Representative Byrd, Representative Freeman, Representative Hall,
Here.
Representative Jernigan, Representative Kumar, Representative Marsh, Representative Ramsey, Representative Sherrill, Representative Smith, Representative Terry, Representative, Chairman, you have a quorum.
Thank you, Madam Clerk. So now, does anybody have any personal orders in that 30-second interlude? If none, we will move on to the calendar. House Bill 1762 by Leader Gant, you're recognized. Have a proper motion second on the bill. No amendments. Okay.
Thank you, Mr. Chairman.
Yes, sir.
And
If you
members,
would just
good to see everybody.
go ahead and describe your legislation.
What this legislation pertains to, and I'll summarize here, and under the present law, an advanced practice registered nurse with a certificate of fitness who provides services in a community mental health center may arrange for required personal review of the advanced practice registered nurse's charts by a collaborating physician with the same authority to render prescriptive services that the nurse practitioner is authorized to render in the office or practice site of the physician, or required visit by a collaborating physician to any remote site, or both via HIPAA-compliant electronic means rather than at the site of the clinic. And this bill extends the above described authorization to also apply to services provided in a federally qualified health center. And that's the underlying thing that we're doing right there, is just extending this to the federally qualified health centers. And we all have them in our district. You know, they're all nonprofit. They provide, great services to our, constituents in our districts.
And it's my understanding that this is just an extension of what we've done previously with mental health facilities.
Correct.
And kind of brought to the forefront by the pandemic and the proliferation of telemedicine, which is one of our big issues this year. Do we have questions of the sponsor?
Chairman, if I could, I'll say this does
Yes,
not
sir.
extend to the private practice side of it.
Yeah.
I know there was some confusion on that, so I want to make that clear.
We have comments or questions of the sponsor? If none, we'll be voting to send this to the full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Chairman.
Thank you, Mr. Sponsor. And we have our second item here is the illustrious Chairman Jernigan. You're recognized. House Bill 1670. Go ahead and explain the bill if you would.
Thank you, Chairman. This is it kind of brought to my attention this past year that there's still language in our code that refers to people as deaf and dumb, and that's a little antiquated and a bit offensive. So we're going to upgrade those anywhere that's said, that we're going to put deaf and hard of hearing, and that's all the bill does.
Do we have comments or questions?
Question on the bill.
Have a question on the bill? No objections. We'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved. Any personal orders? There's a suggestion box for the audience. Come on in. Make us feel better. The suggestion box out in the hall for ways that we can increase our audience participation. So, pardon. Oh, okay. Chair Lady Smith, you're recognized.
I just wanted to acknowledge the doctor of the day, Dr. John Scott. If I remember, you're internal medicine from Vanderbilt University Medical Center, and I think he's in the right crowd in here. Welcome.
Yes, wonderful facility. Yes, sir. Thank you for your service. You're surrounded by some of our illustrious advocates, and we appreciate them as well. So further comments or questions? If none, we will stand for a motion to adjourn. So approved.